introducing your touch to the person, but also starting to palpate to assess. And so this is something that we added into all of the different body parts, is to start with palm presses. And you can also do palm presses down one side, and palm presses down the other. So the idea is, yes, say hello, and start assessing, what do I feel? Where's the tension in this body? What's this body need? So that we can have more of a therapeutic value rather than just following the recipe.
Gotcha. Which is the whole intent, right?
What was that?
That's the whole intent of adding these pieces, right?
Yeah. More therapeutic value. All right.
To the back. We did the palm presses, so integration stroke and stroke erector spinae. Nothing's changed there.
Still just an integration stroke. All right, so erector spinae
Oh,
is
okay.
hand over hand.
Okay.
Hips are moving as if you're fanning.
Okay.
It can be a long stroke. It could be shorter strokes. It's just basically broader, less specific than fanning.
Okay.
And then it can also, if you need to go deeper or want to go deeper, you can change it to a soft fist.
Okay.
All right. What's your next stroke?
Oh, sorry. Palmar knee, erector spinae.
Okay. So this is standing on the opposite side of the table. And we're cross fiber palmar kneading. And then we're going to do
Cross fiber friction.
cross fiber friction. And not deep transverse cross fiber friction.
Right.
From NMT.
And then
And
cross
then
pull
next
traps.
strokes.
Oh, next stroke.
This is where
Oh,
I
okay,
do
yeah.
the three of these together.
That makes sense because it's right there. And then cross pull traps.
Oh yeah, cross pull traps. Cross pull traps. So again, opposite side of the table. And this one, if you want to get in a little deeper,
Hook in.
you can hook in.
Okay.
Okay, what do you got?
Upper body integration stroke.
Wow.
Position at client's pelvis, waist facing their head. Down the
So
arms.
this is basically just an effleurage from the waist. We want to try to invite them to have new things. And then we have this little spinal trio. We have the palm circles. Here we're basically tracing about the size of a little mandarin orange.
Okay.
So mostly thenar eminence is where my pressure is.
Okay.
And a nice rhythmic pace. Because these are
Kind
really
of
for the nervous
hypnotizing.
system. So 3 palm circles, and then thumb circles, and the thumb circles are about the size of a quarter. And this was where we used to teach KC7, but you're teaching that in NMT now.
Yeah.
So we have, instead of the light one, we have the
Therapeutic
rocking
one.
horse.
Gotcha. Okay.
So thumb circles, and then probably the most challenging stroke for all the students is rocking horse.
That makes sense. This is their first introduction to rocking horse.
Yeah. So 2 peace signs hooked in together, hook into that, and then rock your body to do the rocking horse. Is that okay?
Got it. Looks great.
Sometimes people will slide, so I invite them to hook
Do
their,
that instead.
Yeah.
Okay.
And then some people are kind of double jointed and they can do a pony. They're not very good at the pony and don't really like the pony.
But some people need it,
Yeah,
right? Okay.
yeah.
Good alternative.
So rocking horse, I pretty much do rocking horse. So those are all the backstrokes, right?
Okay, yep.
Okay, so then we have the shoulder girdle stroke.
Fan scapula.
So
This is the one you said people have some trouble with?
Yeah, so they need to find the head of the humerus.
Okay.
And they fan right on top of the head of the humerus. And then they're gonna, and this is very similar to what we do for gluteals in essentials. If you were to stick the heel of your hand there and splay your fingers, there's your passes along the scapula for your fan.
Okay.
So start at the head of the humerus, fan supraspinatus, start at the head of the humerus, fan infraspinatus, another pass on infraspinatus, and teres minor. So you can do this in a kneeling bow. I'm not going to kneel because I don't like the floor in my knee, but or a low horse stance. You could also do this with the arm off the table to better find the head of the humerus.
Okay. They're having trouble.
Yeah. Mark likes to teach it with the arm off the table.
That feels better.
Does that feel better to you?
Mm-hmm.
Yeah. A little more specific.
Well, it stretches my arm out too.
Yeah. Yeah. And then palmar knead. And also palmar knead rhomboids. And again, this is just an alternate to the fanning that they already know how to do.
Okay.
Okay.
Awesome.
All right, so now we need to go down.
Lift and knead
on-
shoulder.
Yeah. So it's an effleurage. We're going to come underneath the humerus, lift towards the ceiling, shift our weight down towards the arm, or down towards the hand, and then drag down the arm.
Got it.
So effleurage up, lift, drag. Does that feel okay?
Mm-hmm.
And then forearm ironing, you can use soft fist, use flat of thumb, you can use heel of hand for soft fist. Palmar kneading upper arm is the same as on the posterior aspect.
Okay.
And then the hand, there's 3 shiatsu points. One right in the center, right where the lifelines cross here, one in the middle, and one right here at the base of these middle fingers.
Okay.
These are all circulation points in Chinese medicine.
Okay.
And then,
Circulation points, and those are the okay. Shiatsu palm and thumb circles in palm.
Yep.
Okay.
and then the
Integrated.
moving one, the cha-cha-cha stroke. Step together, step, step together, step, lift and drag again down. So this one is the one where you can really play with depth. You can start with just using your open hands for this stroke. And then you can switch to forearm for this stroke and really add some depth.
Cool.
Pressure okay?
Mm-hmm.
So this is where they can start getting into some of the deeper circulatory work.
Okay. Cool. First intro to that for them.
Yeah.
Nice.
Yeah. All right.
Okay.
Did I forget any?
No.
Okay. That's the back. One half of the
Looks
back.
so good.
One half of the back. Sorry. Are you okay?
Mm-hmm.
If we finish, we'll come back and do the other half of your back for you. All right, so again, as we go into the legs, the palm presses. So on all the other parts besides the back, it's bottom hand is relaxed and soft. Top hand has the pressure.
Okay.
And this is staying receptive. So we can do a series of 1 palm press, again, just to assess and introduce our touch. We can also be more rhythmic with it and do several repetitions. And this is where it becomes more circulatory, where we're pumping. And this is more kind of
Pushing
sports
towards
massage,
the heart kind of thing.
more sports massage oriented.
Okay.
Yeah. So you can do several. So in Swedish when we first introduced strokes, and the word compressions up on the board, that's what this is.
Okay,
It's a rhythmic compression.
gotcha.
Yeah, not a deep tissue compression. A lot of
Oh,
instructors get
okay.
confused with that.
Thanks for clarifying, yeah.
Yeah. All right, so
First thing, after the palm presses, cylindrical effleurage, hand over hand pumping stroke.
Sorry, I was dropping oil. It's about to drip on the table.